Hi, my name is Roza Hirpa, and I'll be demonstrating how to do a piggyback IV insertion. I have been given an order by my physician to administer my patient vancomycin because of a bacterial infection. I'm going to make sure that I verify my doctor's orders and to verify the correct dose, the medication, the route, and the frequency. I'm also going to check and assess for labs, any history of allergies, and make sure that I'm educated on the action of vancomycin, and it's to inhibit cell wall synthesis and to make sure of the side effects, which are GI upset, so that I can educate my patient. The doctor has ordered 1 gram of vancomycin to infuse over 6 hours, and the pharmacy has sent over a 500 milligram dosage, so I'm going to administer 2 milliliters of medication to my patient. I would check the calculation by dividing 50 milliliters by 60 minutes and multiplying that by 10 to get my drop factor of 8 drops per minute. Okay, now I'm going to prepare my my supplies, but before I do that, I'm going to also check any contraindications and anything else that I would need. I would then clean my hands, apply my gloves, and then I would write using my Sharpie. I got it. The name of the drug, the solution, my patient's name, the dosage, the time, and my initials, and also the route. I'll place that down. I would attach a needleless device and get my tubing ready, but before I do that, I already have my gloves on. I'm going to then aspirate the 2 milliliters for my vancomycin. I'm going to put that in my vial, draw up the medication, put the air in, draw up the medication, okay, and then take my tubing. I'm going to alcohol swab the yellow portion of it, let that dry off, and then I'm going to put in my medication, put this in the sharps. I already have my bag labeled. Now I'm going to pop off my top on my baggie. I'm going to pop off a top that would come on here, but I lost it, so I'm not. I'm going to seesaw motion in. I'm going to mix my medication. Okay. So I attach my rubber solution and everything. Now I'm going to prime my tubing. So I'm going to now unclamp it to make sure that the water is going to run. Just put a little bit in. And you can see the tubing. Okay, now I'm going to clamp that off. All right, I'm going to put that back on my tray to take into my patient's room. Now I also have my other supply, which is this, so that my primary can hang lower than my secondary. All right, now I'm going to take off my gloves, walk into my patient's room. I'm going to identify myself. I'm going to also identify my patient using 2 identifiers. I'm going to explain the procedure to my patient. I'm going to reassess any allergies. I'm going to wash my hands, put on my gloves, and I'm going to assess the existing IV site for patency. I'm going to palpate the IV site for any phlebitis or for any pain. Okay, now I'm also going to take my tubing. And I'm going to put it on the top. And then I'm going to take this blue clamp. I'm going to put, this is my primary, so I'm going to put my primary lower than my secondary. So everything is clamped off. My primary is still running. So now what I'm going to do is I'm going to clean the port of my site. Okay, underneath the clamp. I'm going to clean my port using my alcohol swab. I'm going to wait for it to dry. And then I'm going to put in my tubing. I'm going to clamp the primary tubing, and then I'm going to unclamp the piggyback tubing. And then I'm going to establish a flow rate using my watch. And I already said that it's 8 drops per minute. So I'm just going to squeeze this little tube up here. I'm going to time it. Yep. And it's 8 drops per minute. So now I am going to document my procedure that I did, the time, the drug, the dose, the route, the condition of the IV site, the condition of my patient, how he tolerated, the tries, how many times I did it, the volume of fluid that I used, the medication I used, the intake and output, and I'm also going to assess the 4 Ps, which are pain, position, personal belongings, and if my patient has to use the restroom. And after all is said and done, this is my primary, which is on the lower side, and my secondary is on the top, and it's infusing, and that's how I do a piggyback IV insertion. Thank you.
I'm so sorry.